either you start with the digital solution, as you said, and then you have to ask yourself after a while, where does all the money go? And usually the revenue or the profit loss statement of a hospital or a practice, most of the money does not go into software and to pay software providers, but it usually goes to the people providing the service, or maybe even to medication. So if you're a software provider, I started with a purely digital product, then it's just overall unlikely that you can capture most of the value out there and grow it. So if at some point you want to extend the value pool that it's tapping into, you have to capture more of this. And oftentimes in most healthcare systems, you can't avoid having a brick and mortar presence.
Hi, I'm Gaia Salizzoni, and this is Unfiltered Health, a space where we explore how healthcare in Europe is evolving through the insights and experiences of those shaping it. Today, I'm speaking with Lucas Mittelmeier, a board-licensed physician who has worked in strategy consulting for major pharma companies like Novo Nordisk, co-led a VC-backed diagnostic startup, and is now part of the investment team of Heal Capital, a Berlin-based VC focused on health tech. We'll explore which business models work best in European health and how the incentives between investors and startup founders drive health innovation. Let's get into it. Hi, Lucas. I'm very happy that you're joining me today for this chat.
Yeah, likewise. Very happy to be here.
I'm very excited to ask you many things, actually, of your past and your present and maybe your future. So we've been knowing for a while now, and I've been seeing you changing roles quite a lot in a relatively short amount of time. So I guess you have a lot of learnings to share. But first, I would like to start from the very start of your professional career or even education, because I think you have a very interesting and multi-potential profile. So you studied medicine, but I see you went kind of straight into the tech industry from your very early jobs. So I was wondering, why did you study medicine in the first place? Why did you decide to study medicine in the first place? And then why did you move to the tech industries? How was the process, basically?
Absolutely. The first answer, I think, is rather simple. I came from a family of doctors. So my father had been a doctor, my grandfather, and that was a strong influence. Initially, I was kind of rebelling against it, and I almost wanted to avoid it somehow. And I was thinking of studying business first. Then I couldn't really find a subject that I really preferred or found more interesting. And I knew that no matter what I wanted to do later, the, let's say, university career itself would be kind of interesting and challenging and would keep me curious. And that's why I, in the end, did go for medicine and kind of chose the more obvious path. And I didn't regret it. I think the subject, anything I learned, also the practical skills, the people, all that I really enjoyed. I would probably do it again, which is interesting, right? Seeing where I am today. So I think it's just cool to study something gives you some life skills, right? And
Yeah,
gives you some knowledge that you can use one or the other way.
absolutely. Do you think this medicine and healthcare paths helped you in some way to get where you are now?
Absolutely. I mean, in some way, um, it does assign your career or kind of your existence to an area, right? So for me, sometimes it can be tough then to get out of that corner, but it's a very beautiful corner, so I don't mind. In some direction, it set a path, but which many, by the way, medical students or physicians don't know, but it does leave you a lot of options on the table.
Of course, sometimes, I mean, you choose something in life and sometimes life chooses for you, and both things are true, right, in these cases. After you studied and you graduated, you decided, if I'm not wrong, to jump into what you actually liked from the very beginning, which was something more businessy and tech, right? Why didn't you choose to then go into being a doctor, for example?
Yes, and it can look a bit random, right? But the story behind it is there was a trigger, if you want to say so, which was that during medical school, with a couple of friends, I founded a little business on the side. We had this
Okay.
idea at the dinner table to improve hygiene in hospitals. And then we sat together, and none of us had any clue about startups and business in the first place. It was like one law student and two med school students. And we just tried to figure this out and was learning by doing, was super naive in hindsight, but it was a lot of fun. And I think just because of pure, let's say, energy and pure will to do so, we managed to get in a lot of grants and kind of finance this thing and get it to a certain point, build prototypes and then approach customers and everything. In the end, we figured, okay, this is not going to be our life's work. We're not going to go into it full time. So we all separated paths afterwards in a, let's say, a startup way. But it did spark my interest. And I kind of, from that point on, I knew, okay, this might be more interesting than working in hospitals long term. So I was looking for what else to do or where to start, right? Because this startup project wasn't going to be it. And that's how I ended up looking for, let's say, more generalist roles. I think consulting is then just a very obvious one. So I was speaking to many strategy consultancies. In the end, I think more or less randomly decided for a strategy end. I just kept like the people. So I just went for one that kind of felt good and again, didn't regret it. Always told myself I could go back, work in a hospital if I wanted to. But as you can see, that never happened. So I started enjoying it.
I see. So we can say you're a kind of an entrepreneur at heart, and then you followed basically what you liked, which totally makes sense. So after a few years in consulting, I know at some point you also joined a startup as a chief medical officer. And about this, since I mean we're also talking a lot from an entrepreneurial standpoint, I was wondering what was the impact, like going from consulting to startup world is very, I guess, mind-blowing and mind-changing from different points of view. So first of all, did you intentionally were looking for a startup environment or did it just happen? How did it happen? And also when you entered, was your mind changed in some ways?
I was constantly looking for things on the side. I mean, initially when you change jobs, everything's exciting and you have your challenge. Then latest after a year or so, I was already looking for side projects. I mean, you do work long hours in consulting, so it wasn't like I didn't have enough work to do, but I was doing the, I don't know, 70 hours a week or so in consulting. Then on weekends, I would sit and think about side projects and help other people and brainstorm. And that was probably was a sign already that consulting wasn't going to do it for me for long. But then I got in touch with the startup, The Blood, that I ended up joining. And it was more just like one of the riskiest things that I had seen, but that kind of intrigued me. And also the setting was kind of cool. They had built some momentum. So I thought, okay, if I leave and join a startup or an idea, why not go for something very bold and also very medical, so that I could actually kind of use my profile to do something useful. The biggest difference, I would say, between the jobs was probably the type of people you work with and the amount of structure that you have. So people were telling me this before I left consulting. They were saying, "Yeah, but be careful. Like you're working with different types of people. It's gonna feel different. The way you have to navigate and communicate is different." And it was just, I kind of knew it was coming, but it is just a huge change and it is a huge difference. I think anybody considering this kind of move should know it. In these, high pace, very structured jobs like banking, consulting, or law firms or something, right? You have a very homogenous type of employee and type of person. Everybody's like super ambitious, but also super polished. And typically, nobody really stands out for their unique opinions, right? It's all very streamlined. And that's also how you work together. But when you then join a startup or even a VC, all of a sudden things are different. So you have different types of people that are way more opinionated, but also have to be. You can't afford not to have an opinion because there's lots of risk, very little information, and you often have to make decisions based on this. So you really have to know whether you even like this in the first place, right? I ended up really liking it, but it did take some time to get used to this and to operate in an environment where there's lots more variables, where it's just not clear how you do things, right? And consulting where there was a clear script that you had to follow, and if you followed it, you were 100% sure that you were going to be successful. And dealing with way more risk, way more variables, that's, I think, one of the biggest changes, and also learning that definitely stuck with me over time, that you, first of all, have to find out for yourself whether you even like this. And I know that many of my colleagues from med school back then, they also chose the medical profession because there were so few variables in the career path. And yeah, then if you think that you like it, you also have to kind of learn to live with it, with the kind of risk in the dynamic environment.
Yeah, I completely agree. It's really about risk aversion, and each of us is different completely, and it's totally fair that each of us chooses the path that it best fits our attitude and mindset. So let's jump to the present. Now, after being in a very medical space and after being in consulting and startup, you are now part of the investing team of one of the most recognized early stage healthcare investors in Europe, which is Heal Capital. Yeah, at the beginning, I was saying that I saw you switching the table, and I'm really curious to know now, what was your experience in switching? I am a founder myself, as you know, and many times you do see when you're talking to an investor, when this investor has been a founder himself or not, or has at least a founder-friendly approach or not. And this really changes things a lot. And I guess that vice versa, being an investor and talking to a founder that has a very clear idea of how VC work really helps the conversation and really aligns interest on the table. So my question is, you've been on the other side and now you're on the investor side. Are there some things that made you change your mind that you thought before being in a startup were true and now you see them differently?
That's an interesting question. First of all, I agree. It does. Do think it helps to have seen the other side of it. I was raising the pre-seed with the blood back then, with lots of calls. Back then, I think my attitude definitely changed towards different things. If I would have to go back and tell myself at that time a few things, I would probably give myself a few pieces of advice. One is that the decision whether you generally like the startup or not, or whether there's generally a chance to invest, the decision is made really within tens or 20 of seconds. It's that simple. So seeing the pitch deck or meeting the founder for the first time, 80% or so of the startups or the people you immediately put in the no bucket. And even if you, out of courtesy or whatever, or because you're just a bit curious about the topic, you speak to them or take a call, right? Or maybe set up something else. The decision comes very quickly and also has to be because you don't have much time. So it's a bit unfortunate, right? And it does sound a bit superficial, but it's just necessary and just part of the industry. And any effort that as a founder you put into this type of relationship, although you kind of also know that there's already a no, is just too much, right? Even the like follow-up email asking, hey, can we talk about this or that? Is not necessary. I did it back then, so I was pinging VCs afterwards saying, hey, but can we give some more, can we give some more feedback? Can we speak one more time? Well, hey, we've pivoted a bit. Can we speak again? Usually it's not worth it. So this kind of way you funnel your energy and then which relationships you nourish and they're worth nourishing, that definitely is one of the major pieces that has changed for me.
I have a follow-up question on this. You're early stage investors right now, so I'm wondering if this applies more to early stage compared to later stage where you can crunch numbers better. And also, like, is it more about the founder in this early stage, or is it more about really the concept, the idea for you?
The leading two factors are usually team and market. It can be, and team probably has the higher priority. And it's also what you quickly assess in the first few seconds, right? Whether you think the type of personality is the right one. And also something that's unfortunately super hard to feedback on, right? You don't want to get into fights about what you think about a person because it's very easy to get derailed and to get personal. Then market is just depends on your thesis as a VC. And VC has their own thesis about which market is a good one or a bad one. Sometimes more let's say, obvious and you present it on the internet and you write about it. But even if not, everybody has their kind of biases. And if one of these things are off, so either you think it's the type of person that maybe doesn't have the endurance or energy or whatever to pull it off, that of course is a knockout criteria. But also if you're in a market, let's take the typical example in Germany here. If you build a Diga, an old school Diga, many investors would say just not the right market, even if you kind of like the person. So I guess these are the two most immediate types of decline reasons.
Yeah. And personally, this relates to a personal battle I have, and I think many founders have, which is investors' feedback. As you say, of course, if the feedback is exclusively on the person, then I totally understand you as an investor don't want to judge, even because you can't judge. So it doesn't really make sense to say, I don't like you as a person. That's not a useful feedback. But I feel like many times It's not just the founders, and you can still, as an investor, give proper feedback on the market, on the product, on the trajectory, on acquisition, like anything really that can help the founder, even just one line. Anything is helpful, and saying kind of bullshit answers sometimes just because you don't want to give a strong opinion on someone doesn't really help founders. But you probably know better than me, and I'm sure that you're in the good side of the table in that sense.
But it's so true. And I think it's one of the biggest problems in the industry. And I'm not saying that anyone is to blame. It's just that the incentives are so opposite. So as a founder, you want more feedback because you want to improve your pitch and maybe even your whole business, right? That's a clear incentive. And also in the end, you want funding, which leads to, okay, whatever kind of contact with VC I can create is good. That I think often isn't true. There's one myth we can kind of debunk. And on the VC side, the incentive is of course to see as much as you can to find enough good companies to invest in, which is just a whole time prioritization exercise. It's also something that's probably tough for founders to understand if they haven't seen the other side. That any kind of minute a day you spend on a deal that you know that you're not going to do, it accumulates, right? If you're a very junior in VC, maybe you still have the time to do this. But then latest at partner level, you get spammed with emails the whole day, and then people want this or that feedback, and somebody you just can't answer the emails anymore. You just can't take the calls anymore. And then you have this phenomenon that every founder knows that often you don't get replies in the first place, and often you just get very quick 1 sentence, 2 sentence feedback. But it's not because they don't maybe want to give feedback or they don't not meaning well with you. It's just pure time question. Plus, and that's the second unfortunate element there, you just don't want to get into fights and ruin your reputation, right? So it's much, much easier. Just give superficial feedback. And I've noticed it myself, right? I went into this saying, okay, I'm going to be different. I'm going to give very detailed feedback. I'm going to give very honest feedback. And the first thing you notice, it's super tough to give feedback on the person because everybody feels like, yeah, like nice person, but if things get really tough, will they hold up to it? Not sure. And then we decline. It's very tough to feedback. Then the person goes, no, that's not true. So, and you can't prove it, right? There's no data that you can point to. But wait, by the way, what does it mean for the founders end then, right? I think a very good skill is spotting if the investor is interested or not early on, and then also just being super consequent with dropping ones that just feel mildly interested, right? What does it do? It gives you time to focus on the really interested ones, and it probably makes the process even faster. And it might feel very uncomfortable in the beginning because all of a sudden your list of interested VCs goes from 20 to 8, right? But I don't think it's an actual loss. It's just an increase in focus. And the more you can develop this antenna for interest, the better you're off.
Absolutely. Spotting early the red flags and dropping it totally makes sense on the founder side. So let's see, there are some areas of improvement from both sides. We could close this chapter with that. Okay, so I'd really like to deep dive into your strong opinion on the market because I know you have money and I've seen you written about it lately. So the first thing related to the fund you're working in, I remember a few years ago, I think like 2-3 years ago, there was a strong thesis going around, which is the so-called VIMPRO thesis. So the vertically integrated providers, healthcare providers, which basically means having independent providers of healthcare services that don't just do one thing, that they are definitely vertical on something. So they are in a specific area or even just in a specific pathology, but they follow on the whole patient journey end to end or almost end to end, and are of course technology enabled to make all of this more efficient in addition to being more high quality for the patient. Again, is a thesis that went around from many VCs and founders as well in Europe, and I saw this whole idea changing lately a lot due to seeing actual startups maybe failing in this space. I was wondering, what do you think about it in general, and if you think that is still something valid and worth it to pursue today for a startup?
I agree. The ideas, or let's say the theses in this space, have probably changed. And if you look at VimPro, I mean, the original definition was vertically integrated micro providers. And I think the biggest problem was probably the micro part, right? You don't want it to stay too small to create a VC backable business. I guess that what's often happened. It's very feasible if you choose your vertical. Let's say you go for, I don't know, hormonal health or so. and then you build something. You can definitely attract a certain crowd, but then how do you make sure that it's not too small, the crowd, and actually still grow? And the second question that many have faced is how do you really achieve this vertical integration? So if in the truest sense, you would have to go from early screening or even, let's say, well-being for these types of patients to diagnosis, to treatment, to aftercare, kind of cover the whole value chain, right? And oftentimes then you run into these problems. So how, let's say, if you do early screening for them, but then they actually have some kind of symptom or disease, then what happens if they run into a reimbursed area of healthcare? Can you also cover that? And what happens if they need very specialist care? Can you also cover that? So lots of operational challenges and go-to-market challenges that suddenly popped up. And it feels like not many startups have been able to figure this out, at least at scale yet. And there's some, let's say, Bitcoin vertical providers like also more consumer oriented, like Hims and Hers in the US that are a huge, um, huge idol for many. And there's also one or two in our portfolio that have seen good results, but it's not like not like the blueprint that everybody thought it would be in the beginning that you could just go and build.
So what you're saying is it is mostly a matter of scale and of size of the market. But would you still say that owning the whole value chain as much as possible, is it still a pro? Like, does it actually steer success for startups, or are there models that are starting to be blueprints in healthcare in Europe?
Let's say if we were to invest in someone who presents us this idea, at least they would have to show us good proof that they understand the full vertical integration and what's necessary for it. Not just pretend because they have a nice app, people will stay with them the whole journey. I think it's just not true. There's more needed. There's you have to plug into payment incentives, right? How do you get the people to pay out of pocket for something, but maybe then the insurance pay for something else? There has to be like a smooth path also on the money side of things and on the payment side of things. And on top, you coordinate with all the stakeholders, the existing doctors and hospitals. So anything that makes this thing truly vertical, I think we would have to have a good feeling that they understand it, and potentially, yeah, even tap into the conventional healthcare system to do it. And otherwise, I think the vertical idea can still make sense. In the end, it's a case by case decision, and I'm pretty sure there's not going to be a blueprint. There's going to be a decision vertical by vertical. Can this make sense? And if not, the other approach is still doing something more horizontal, right? It's also super valid. I still believe that both kind of approaches can work.
Yeah. And are you seeing from your portfolio companies or from the market in general, are you seeing some models, not necessarily vertical in that sense, that are kind of working? Because the thing is, the business model is probably the number one reason for failure in Europe, because we either copy paste some models from the States, which then we discover don't really apply to the European ecosystem because of fragmentation of the markets, because of size of the market, because of bureaucracy, legal frameworks, etc. Or we start models from scratch until we actually crack some. Do you think we have currently some models that are cracking it? I know it's a big question.
Here in Europe, there hasn't been this insanely large, multi-billion outcome yet in that space. At least not that I can at the moment think of. So the biggest successes we had were more like pure software plays, more horizontal. Let's say Doctolib offering appointments to any kind of doctor in the end. It's not a vertical play, or even Alain in France building an insurance solution, which is definitely not something you could call a vertical provider. And there's been some, let's say, still good outcomes, or let's say ones that are in a good way and could maybe become larger. So, I mean, just from speaking from our portfolio, we invested in Abi Medical a while ago. It's a primary care practice chain that's tech enabled and digital at its core. I'm currently in Germany. And they could build this primary care, not per definition vertical, but could build this thing around primary care where they own the patient journey completely, and they're in a good way. They've just advanced to remote monitoring programs. They are doing direct contracts with the insurances to make it happen. They, for example, have a good chance over long term to grow into a provider that can actually lead people from the first ever contact when they have the first symptoms to an effective aftercare where they partner with more specialist providers to make it happen. But it all is one smooth journey. This is one example. And the other one from our portfolio is in the UK, Paloma Health, which just recently launched. And they are starting in mental health as their vertical and started with one piece, but of course, thinking of growing into other parts of this vertical chain. But again, here, I guess the script is not written. They could also go horizontal if they wanted and just
Totally.
plug in other disease areas. And maybe you also need this certain flexibility and just find value where it is without sticking to a Vim-Pro script.
Yeah, makes sense. And actually, I'm seeing more and more companies, especially in Germany. I'm not sure if that's a bias because I'm in Berlin, that start as Ave Medical from a physical store, like an in-person kind of piece of the funnel, and then they are able to experience the whole journey already in a physical space, in a more traditional space. That's a very strong basis that is successful enough to then build up even more models, whether it is vertical or horizontal. I see more and more companies either starting from a physical place or going into a physical place, being digital. And I'm just wondering if you are also seeing that.
Absolutely. I think both is feasible. And it becomes obvious at some point. Either you start with the digital solution, as you said, and then you have to ask yourself after a while, where does all the money go? And usually, if you think about, let's say, the revenue or the profit loss statement of a hospital or a practice, to take a very typical healthcare player there, most of the money does not go into software and to pay software providers, but it usually goes to the people providing the service.
Yeah.
And to other things, or maybe even to medication. So if you're a software provider, I started with a purely digital product, then it's just overall unlikely that you can capture most of the value out there and grow. And so at some point, if you want to extend the value pool that it's tapping into, you have to capture more of this. And oftentimes in most healthcare systems, you can't avoid having a brick and mortar presence because that's linked to it. So oftentimes you're not allowed to have a pure digital presence or to do certain procedures in purely digital way. So this idea of capturing more value forces you into brick and mortar. Not because people like buying practices and or running hospitals per se. It's typically because you have to, from a regulatory point of view, to unlock certain budgets. And same the other way. Why do people who start out with a practice, a brick and mortar infrastructure, go to digital? Well, they already have a certain value and revenue potential they could tap into.
Exactly.
But then the margins suck, and then you think about how to improve them, and then you're thinking, okay, maybe I can out-license some of my software that I've built. There's a chain in Germany doing this called Eternal. They run these full service, let's say, WeWorks for doctors, kind of, where they can rent full practices. They're also out licensing their software because it seems more scalable, the margins, etc. So both have their advantages, and both are feasible. And I can not tell you which way around is the better one.
No, no one can. But I find it very exciting and very beautiful the fact that the more we go on, the more we have industries going deeply into digital only. Whereas healthcare is healthcare, you can't really avoid having physical touch points. And we're going into a much more hybrid situation where we try to efficientize all the costs and times as well and resources, but at the same time guarantee a good experience. So I really hope this works out. Okay, so you mentioned many times money, and I actually read an article of yours that you wrote recently that I can link to this podcast as well, where you basically talk about the European innovation dilemma. And I quote, you wrote, "Everybody likes innovation, but nobody wants to pay for it." And I think this is so true. And again, the model, the revenue model and the payment model is the killing factor probably for many startups in Europe that work in health. Could you walk us through what's this dilemma and who do you see as the main payers?
It's very easy to think idealistically in this space, right? And you, of course, shouldn't lose sight of the patient benefit and better quality of care. It should always be parts of your decisions, be it on the, let's say, the caretaker side, but also on the startup side or on the payer side, right? Whoever should always have that in mind. But you need this catalyzer to make it happen, and that is just the financial incentive. So both have to come together, and it's way easier to forget the financial side of things. And the typical issue that we see when startups sell to, let's take hospitals and practices again, when I sell to those classic healthcare institutions, is that the software budget or any other type of innovation budget isn't very high. All of these customers, per definition, growth restrained and budget restrained. These are not highly growing big tech companies that can afford to have a budget here or there and experiment, but they have very, very little wiggle room to try new things and especially plug in ongoing costs. So that's the typical dilemma. And the way that people can bridge it is to offer something in return. A time saving, for example, and thus maybe cost saving would have to be super tangible. You have to prove it, actually, create some evidence to show to them, unless they're very innovative. Or you create some kind of income, right? And there can be revenue sharing agreements, which is what I wrote about, where you can maybe help them with your software to charge for a new type of consultation or service to their patients. That creates their income. Then you split the income, and everybody's happy because technically there's no cost to them, right? It's just new income that they split.
Yeah.
Those are typical considerations you have to go through. And one big hope that we have going forward is that because these software and innovation budgets are so slim, that maybe with the more automation we get in healthcare, the more AI-based agents, what you call them these days, come into existence, that maybe some hospitals will be able to take some of their costs that they have for personnel and for staff and reallocate that to these AI tools, because they essentially are able to replace that.
Makes sense. I was talking the other day with another guest, and he was saying just we really have to go up the chain of resources. So on the one hand, implement as much technology as we can, but on the other hand, we can also make more efficient the human resources that we have and what they can do. Maybe nurses can do the job of doctors sometimes, and the doctors can do the job of someone else. I was curious what you just said about having margins and budgets for innovation. Do you think it's true in Europe only for healthcare providers, such as clinics, hospitals, and so on, or also for insurances? Does the same thing apply to them?
In a sense, and you have to differentiate between types of insurances. So many of especially the large European countries, let's take France, UK, Germany, they have very, very comprehensive public insurance systems. And each of these that I've ever looked into has some kind of budgeting going on. So they're not, let's say, free market driven. They're by definition kind of top down and very rigorous and they're not able to move freely, and they're not working with incentives other than budgeting. And then what happens is that you don't have room to grow and to test as much. Because if there's a cap budget for things, any money that you want to take out as a startup has to come from someone or something else. Like you kind of have to replace other spendings instead of unlocking new money. That's a bit generalized, but I think generally holds true. Let's take in Germany up until now, might change soon. There's a budgeting, for example, for primary care. So each quarter, the primary care doctor kind of knows how much they can earn. It's limited. So if they treat 200 or 300 patients a quarter, typically it doesn't matter at some point because the budget is limited, and that leaves them little room, right? If they have a software now that gets them 100 more patients through the door per quarter because they're more effective, they still won't do it because there's not more money. And that's one of typical dilemmas, although you have to always go case by case with these things.
Yeah.
That happens in these very public, very budgeted systems. And it's just a bit easier in a more private insurance environments because they're more incentivized to plan with a value-based approach. And that can mean a lot, but generally the idea is if you do something that's valuable, save time, save costs, increase quality, the assumption is that somehow it's worth paying for, and then get a contract.
I definitely see this more in the private sector, as many times innovation starts in the private and then shifts to the public. So you mentioned the value-based approach, which in the long term makes you save money. That's the idea. And we see this model, especially in the United States, that is called payvider. So those organizations that provide both healthcare services and pay as an insurance. And I think it's genius in a market like the United States where everyone is under insurance, whether it is public or private, and insurances are very open or much more open to innovation than they are in Europe. So I'm wondering, do you think this kind of model could apply even to some extent in Europe? Or is something that is going to stay in the United States?
I'm not an expert on the US system, but yeah, I read a lot about how they organize care. We often have startups that expand to the US, and it does seem that this model also has issues. I mean,
Of
I guess
course.
that's obvious. Generally, I think the trend is the same here. I think we haven't mentioned it yet, but our fund is backed by many private health insurers here in Germany. And of course, we have conversations with them, ask them how they're planning to develop their business. Moving more into a provider role is definitely part of this. It's just we're a bit, we're significantly behind the US in this kind of trend. And also the regulatory framework and the political framework is, of course, a different one because private health insurers are just a smaller part of the German insurance landscape. But the idea is the same, and they're starting to do it. I'll take Avi Medical again as an example, where they've already partnered with the private health insurance for the patients that are insured with them to get a more tailored, more effective program. That is basically the beginning of value-based care, right? This insurance is
It
willing to
is.
pay more or pay in a more flexible way because they know and they've seen in the data that Avi Medical is just providing the care better than others. And I think this is going to start spreading. So the pressure that we have on the healthcare system these days, now the premiums have just increased significantly for the public insurance system here in Germany. And the pressure that we've seen in other systems like the UK's NHS is forcing people to change. I think political will wasn't there. And the, let's say, upside of having this pressure kind of now forces people to experiment.
I think this is all very exciting, and I really hope it's going to spread as well, honestly. Thank you a lot, Lucas, for all these opinions and pieces of advice. I think many will benefit from it. So thanks again for being here.
Absolutely. Thanks.